Hello, everyone, and welcome back to Black Mental Health Matters. I'm Dr. Carrie Ann Williams. I'm a psychiatrist practicing in Massachusetts, and this is a show that's about everything related to mental wellness in the Black community. So if you have any questions or comments throughout the show, just drop a comment. This is streaming live on Facebook and YouTube. So you can just drop a comment and I'll see it and answer any questions you may have. Today's topic is going to be trauma and the Black community. And today I have with me Dr. Nicole Christian-Brathwaite. Welcome to the show.
Thank you for having me, Dr. Williams.
So Dr. Nicole Christian-Brathwaite is the Senior Vice President and Medical Director of Array Behavioral Care, which is the leading and largest tele-behavioral company in the country. She's also the founder and CEO of Well Minds Psychiatry and Consulting Company, PLLC. And she is going to be talking with us today about trauma, because that's one of her areas of interest. Tell us a little bit about yourself, what your professional interests are, and kind of how why you decided to kind of specialize in trauma.
Sure. So I am similar to you. I'm a child, adolescent, and adult psychiatrist. And I also have a specialty in maternal mental health, postpartum, and perinatal mental health. And I think I really started to gain interest in trauma during training, realizing that so many people in communities of color were presenting with significant mental illness, often delay in treatment. And so it wasn't that we have a tendency to have more severe illness, but it was that by the time it was treated, by the time we recognized it or the medical field recognized it had gone on for so long. And not only that, it often wasn't just depression or anxiety. There was so much more. There were the financial stressors, there were the stressors at work, there were the microaggressions that people were experiencing. And I realized that there has to be more to what people of color experience, what underrepresented groups experience. And so I started to take additional courses and do training and reading and writing to get a better understanding of what's actually happening in communities of color, specifically Black communities. And that's when I discovered this term racial trauma. And no one ever talked about it in residency training. No one ever talked about it in hospitals. It was literally a term that I never heard throughout the early parts of my career. It wasn't until I was intentional about learning about it. And even in trauma circles where they're trauma experts, they don't talk about racial trauma. And so that's when I realized that this is an issue. One, because people aren't willing to acknowledge it. So it's a huge problem, but also because it's going unrecognized and untreated when people are actually in mental health care.
Yeah. And of course, if as the professionals, we're not being taught about it, then for the people experiencing it, what kind of validation do they have that what they're going through is something that has a name and can be addressed?
Right. Exactly.
Mm-hmm.
Exactly.
And so racial trauma is one of the kinds of trauma that folks in the Black community experience that they didn't even, it wasn't really acknowledged. What are some of the other kinds of trauma that can either go along with that or that we experience in our communities that we should be aware of?
Sure. So, and I'm always very clear about this. I cannot define what is trauma for you or what is trauma for someone else. And so when someone tells me this was painful, this left an internal scar, or I constantly think about this, or I ruminate about it, I have nightmares about it, that incident, it may or may not feel meaningful to me, but it was meaningful to them. And so when I think about trauma, I tend to have a looser definition of trauma because so many people are walking around with significant scars and no one's been able to label that for them to say that was traumatic. I mean, so many of us have grown up and terrible things have happened and we're like, well, that happens to everybody. That's just what you have to deal with as a Black person, not realizing that, yes, that is what a lot of us have to deal with, but it is still trauma. And so even thinking about the more formal definition of trauma, there's a study called the ACE study, or Adverse Childhood Experiences study. And that original study looked at 10 negative things that could happen in your life before the age of 18. So experiencing abuse or neglect, or having an immediate family member with a substance abuse problem, or having a parent with severe mental illness, or having a parent who was incarcerated. And if you had experienced any of those things before the age of 18, you had a greater risk of having medical and mental health problems later. But what if you grew up in poverty? What if you experienced racism or discrimination as a child? What if you are profiled by police? So a later study in Philadelphia called the Community ACE study found that if you experience any of those community adverse events like food insecurity or housing insecurity or redlining or having to have a parent who's working multiple jobs just to make ends meet, those things are also trauma. So essentially any negative events you experience in your home or in your community, any of those things could be traumatic. And one important thing that research has shown us consistently with any kind of trauma, it's cumulative. And the more trauma you experience, the greater the likelihood that you could have long-term negative health or mental health consequences. But if you have 4 or 5 of those ACEs before the age of 18, there's a significantly increased risk of suicide later in life, of teen pregnancy, of dropping out of school, of alcoholism, of breast cancer, ovarian cancer. And if you have 6 or more of those negative experiences, whether it's in your home or in the community before the age of 18, your life expectancy decreases by 20 years. And so it's important that we realize all of these events are traumatic and all of them have severe consequences later in life, which is, it's no coincidence that a lot of comorbidities like heart disease and diabetes and obesity, which are more common in communities of color and are, increasing morbidity due to COVID, are also directly connected to the amount of trauma you experienced early in life.
Wow. Well, trauma is cumulative. I think that's just one of the key things that I just want to re-emphasize, because what I sometimes see, and it goes back to something you said earlier, is people begin to just accept that this is just the way things are. Yeah. This is just how I am, or this is just how people in my family are. This is just how our community is, not realizing that it is actually cumulative trauma that is kind of adding up and leading to certain things like health disparities and all of that. So that's, I think, profound. And I want to make sure we just kind of pause and reflect on that particular aspect of the effects of trauma, health problems, and life expectancy being lower. And that can lead into all kinds of things about how, the way that medicine is taught, how we're often taught that about the healthcare of different racial groups being different, and just not really thinking about where that comes from, and kind of how it comes to be that way.
Exactly. I'm very frustrated when I hear people say being Black is a risk factor. No, being Black is not the risk factor. Being Black in America and experiencing racism is the risk factor. My skin color does not increase my risk. My skin color and the way I'm treated by other people and the oppression that happens, that's the risk factor. And so just being very clear that simply being of a certain race or ethnicity does not increase your risk. It's what happens after you're born and walk into the community and what you experience in that world, that's the increased risk. I even think about for example, growing up in an impoverished community, you're just simply being born. And so that study was done in Philadelphia, where I'm from, and a large majority of residents in Philadelphia live below the poverty line. So simply being born in North Philadelphia, you already have multiple ACEs, just being born. And so already your risk is increased compared to someone who lives outside of Philadelphia in a suburb, simply just being born in that community. And many of the factors are, if not all of the factors, are secondary to structural and institutional racism. That community, the way it was designed, was very intentional. And that was intentional, as a result of racism. And so it's difficult to not connect all of those dots and for people to say race doesn't matter. It does. It always does.
And to not kind of see that connection between adversity. Because, as you mentioned, how to define trauma, right? Because there's all different kinds of adversity that people can experience that can be traumatic to them.
Right.
And I wanted you to maybe talk a little bit about how maybe that connection with trauma and the body. How what does trauma do to the body? How can it, potentially even lead to sicknesses or illnesses? What's going on?
Sure. So I always use this example. I'm not from Boston originally. I'm from Philly, as I mentioned. And driving in Boston is so stressful. I've been in Boston for 11 years and still every single time I get into the car, I find that I go into survival mode. And so essentially that's what happens when you experience a traumatic experience, or another term is toxic stress. So it's that chronic, unpredictable, frequent, prolonged stress and, or, just any really negative stress. And so what happens when you're under stress, your heart rate increases, your blood pressure increases, your muscles may tighten, your adrenaline increases, those stress hormones, cortisol increases, and you go into fight, flight, or freeze. That is meant to be a short-term, time-limited experience. That is not meant to be a prolonged experience, right? Going into fight, flight, or freeze makes sense when you're trying to survive a car accident or a wild animal running into the room, right? Like in that moment, you need to focus on saving yourself. So literally the focus, our brain focuses on the survival parts of our brain. So the lower parts of our brain that tell our heart to beat and tell our muscles to tense, and you just immediately, without thinking, go into that reaction. That frontal part of our brain is the thinking, executive functioning, critical thinking, planning part of our brain. That's not what we use when we are in fight, flight, or freeze. And so when I'm driving in Boston, I feel like I go into fight, flight, or freeze because I am just like, I don't know when someone is going to come over and not use a turn signal. I don't know when something crazy is going to happen on 93. And I'm in that fight, flight, or freeze. And in that moment, you're not able to critically think, right? Like you're just in the moment trying to survive. And so even if we're thinking about a child who experiences trauma before they walk into their school, maybe they walk through a community where they've witnessed community violence and they sit down, but they're still in that fight, flight, or freeze because nothing has really happened to help them feel safe or for them to calm down. They're not able to think clearly. And again, in a normal situation, that fight, flight, or freeze should go away. All of the stress hormones should decrease and you should be back to kind of that at-rest state. But if you are a child or an individual who every time you walk into a building, you feel unsafe, or every time you leave your house, you fear that you're going to be profiled, or you fear if you're even going to make it from point A to point B, that fight, flight, or freeze keeps happening. So that stress hormone keeps increasing, the cortisol, the adrenaline, your blood pressure it stays up for a persistent amount of time. Your heart rate is increased. And that leads to chronic inflammation. And chronic stress, again, and chronic inflammation leads to chronic disease. And so the point is that fight, flight, or freeze is useful, but it's not useful when it's prolonged. It's not useful when it keeps happening over and over again, because our bodies were not meant to sustain that high stress response. And when it is sustained, or when you always have to be in that fight, flight, or freeze because you never feel safe, because you're never in an environment where you feel like you can let your guard down, then that ultimately leads to long-term consequences. And for kids, it also means that they can't learn as well. Because if you're in a classroom and you're in fight, flight, or freeze, you're not listening to what the teacher says. You're listening to what's around you. You're looking at what they're doing because you don't feel safe. And so it impacts a kid's ability to retain information and learn new information and focus and even develop safe relationships. And so the impact of trauma is long-term, but it's also very much in the immediate in terms of just how you engage day to day.
Wow. And as you're mentioning that, I'm also kind of thinking about when people are in fight, flight, or freeze, I think about how if you're in a survival situation, if you're threatened, you respond as though you're being threatened.
Exactly.
And so sometimes, people, if, they're startled or they're profiled or these things happen, they're kind of in survival mode and they may respond as though they're at risk, because they kind of are.
Right.
And so sometimes we see behaviors that get misinterpreted as kind of, well, why did this person act this way? Why didn't they just do this or that? Why did this child do this? Why did this adult do this when the police came by? Not realizing that if you're in survival mode, you're going to be a little bit twitchy. You might move your hand a certain way or whatever. And it's not because you're being threatening.
Right. Exactly. And when I talk to teachers, I say this all the time. If you see a kid is in that fight, flight, or freeze, they're reactive, they're shut down, they're disengaged, and you tell them, do this assignment or do this homework, or you raise your voice, or your body position changes in the way that may feel threatening to them, and they explode. And the teacher's reaction is, well, I didn't even say anything. Why did they respond like that? Because that child was likely in that survival mode, and what you did or said did not feel safe to them, or because, again, when you're in survival mode, you're not thinking clearly. Like when I'm driving in Boston, if someone were to say, Nicole, give me the DSM-5 definition for depression. And I'm like, I don't know. I can't even think clearly. I just need to get off of 93. Like I can't focus on anything else. And so imagine being a 9-year-old having just witnessed domestic violence, or being a child, an LGBTQ child who was just bullied or doesn't feel safe at home and then has to come to school and the teacher says, do this right now, and they're still reactive, of course they're going to respond in a way that may seem out of proportion to the immediate ask, but not realizing there's so much pain behind that. And so before we can engage with that kid, we have to get them out of survival mode. Before you can walk into work and be productive, you have to get out of survival mode and feel safe. But there's so many variables that actually allow a person to feel safe.
Wow. I mean, I guess maybe we should talk a little bit about what are some of the general kind of signs that a person may be, what they're experiencing maybe as a result of adversity or traumatic stress or even toxic kind of, toxic stress, that kind of thing. What are some of the signs? We talked about a few of them in terms of the fight, flight, or freeze response. What are some other things people can look for and say, oh, maybe this thing that I'm experiencing, it could be as a result of what I've been through?
Sure. And I mean, again, it really could be anything, particularly if we were to go back to the racial trauma or experiencing racism. There are so many studies directly connecting an experience of racism to an increased risk of a variety of mental illnesses, generalized anxiety disorder, major depressive disorder, panic disorder, social anxiety disorder. And then, even when we look at studies and they say, well, maybe the increased risk of PTSD or the increased risk of anxiety were due to other risk factors in African-American communities. If you control for every other variable and just look at the experience of racism and trauma, Black and Latino individuals are still at a higher rate for experiencing, or have a higher risk, for experiencing PTSD. And so I would say it's not even just one thing. Certainly feeling more reactive, certainly having somatic symptoms before you walk into work, like you're feeling nauseous, or your back hurts, or your neck hurts, or you're feeling very jumpy, or you walk into a certain setting and you shut down, or you're feeling numb, or you're physically there, but mentally and emotionally, you're completely disconnected. So certainly those may be signs that you've experienced trauma, or maybe actively experiencing trauma in a certain environment, but also the fact that you're experiencing depression, or you're dealing with symptoms of PTSD, and you may not be able to identify a specific traumatic experience. Often when we think about PTSD, we're looking for a history of some major horrible life experience, like rape or physical abuse. That doesn't have to happen. It doesn't need to be such a huge event for you to experience PTSD, because again, trauma is cumulative. So 10 small traumatic events can absolutely lead to PTSD or anxiety or major depressive disorder. And so, I would say anytime I meet with a person, I'm also asking about their trauma history, because it inevitably contributes to what they're coming to me for.
Wow. So from what you're saying, that trauma or traumatic experience can then lead to really any of the mental health diagnoses we can think of, anxiety, depression. So people could be going through these emotional experiences, even mood changes, and kind of not know that it's because their systems have been adversely affected by cumulative stress, cumulative trauma.
Right.
Go ahead.
No, I was saying there's a study that looks at like the frequency of experiencing racism in individuals. And so the frequency of race-based discrimination predicted lifetime prevalence of generalized anxiety disorder. So the more times you were a victim of racism, the greater the risk that you'll develop anxiety later in life.
Wow. And then you also mentioned that for kids, that it can affect their learning in school. Right. And also misinterpreting of like behaviors that they may have. Are there other things to think of? Do kids at that young age also experience some of the mood changes too? Like, tell us a little bit about that.
Oh, I mean, absolutely. And even if we were to look at some of the numbers in schools, so 70% of the kids referred to law enforcement or resource officers in the school setting are Black and Latino kids. And even starting in preschool, and my son unfortunately experienced racism when he was 3. And although he doesn't remember the details of that experience, that sticks with him. So Black kids make up, and I can't even remember the exact number, but I want to say about 18% of preschool enrollment. But Black kids receive over 40% of out of school suspensions or expulsions in preschool. Yeah. And so not only will kids in school kids of color are at greater risk of experiencing trauma outside of school. They get into school and they experience increased discrimination. So for the same exact behavior, a white student who may show some externalizing behaviors, maybe acting out in class or not completing their assignments or having a hard time with peers, those kids will be referred for therapy. A Black child doing the exact same thing is 3 times more likely to be suspended or expelled. And so a lot of those behaviors that get Black children expelled are the behaviors that may be secondary to trauma, but they're not being referred to therapy. They're not even being screened for mental health problems. They're being labeled as deviant or oppositional defiance disorder or conduct disorder, but very rarely major depressive disorder or generalized anxiety disorder. And so if there's a child in school who's struggling in any way, I would want them screened for trauma, for experience of trauma, and to ask what's happening behind this behavior. What are they trying to communicate? What led to this behavior? And one of the kind of classic ways that we approach kids from a trauma perspective is not asking what's wrong with you, not looking at a kid and pointing a finger and making assumptions and, oh my gosh, that kid is so bad and they cause so many problems, versus saying this kid is struggling. What happened to them? What's led to this behavior? What's the pain causing this behavior? And so again, across the board, that can be just about any behavior we see in the classroom. It may not all be due to trauma, but if we aren't at least asking the question, we're missing it. We're missing way too many kids.
So instead of saying what's wrong with them, what happened to them?
Right.
So there's kind of this, of course, a bias where if there is a student who's not Black, or student who's white, and there's some behavior that arises, there's a sense that this is different from what we expect. So let's look into this and find out what's going on. Right. But if a Black student is having a particular behavior, it's a bit kind of what people expect. So they just say, oh, let's just refer them to let's just kind of discipline them.
Right.
Because this is just how those kids are.
Right. Exactly. And that even may feel threatening. Disciplining a child instead of supporting a child is threatening. And so then that may re-trigger or re-traumatize a child. And then you suspend them or expel them. So they're missing school. It's disrupting their education. Then they get back into school. They feel even less safe because they don't know who they can trust. They're farther behind in their schoolwork. And then they get stuck in this cycle of trauma where the discipline further traumatizes them. They miss more school. And, even one suspension or expulsion can lead to high school dropout. Just one increases that chance, versus they're struggling. Let's get them additional supports. Let's find ways to keep them in school. Let's find support so that the teacher can educate them or can teach them. And, again, what happens in predominantly white school districts for white students, those things do not happen in predominantly Black or Latino school districts.
Wow. And that's not even to mention the idea that in certain schools, there are police officers. They call them school resource officers, right. And they're present. And there's a big debate about how that affects students of color and that they don't feel safe having them there.
Right.
And it kind of is part of the reason why they're more likely to end up having contact with the legal system, even starting from within their own school. They're having contact with the legal system versus getting the appropriate mental health services for the trauma that they've experienced in their lives. And so they respond to these police officers with trauma responses, and then it kind of leads to legal consequences. Whole nother debate.
I mean, if we start on the school to prison pipeline, like that's an entirely different conversation. But again, it's all connected.
Yeah, it's all connected because that's wrapped up in the trauma that we see with a lot of our kids.
Yep.
Literally kind of seeing kids who, when they hear police sirens, you can see their eyes glaze over because they're kind of like having a trauma response. Yeah. Just by hearing sirens in the background, it's very kind of disappointing that our society has kind of gotten to this point.
And I mean, again, even just, and I don't want to say like living in America increases the risk of trauma, but it does. I remember when Ahmaud Arbery was killed. And I try really hard never to have the news on in my house. My mother lives with us. She's like a news junkie. She watches it 24/7. It's always on. And so my 7-year-old, at the time he was 6, went downstairs, and, again, because Black death is entertainment. And so they show these videos over and over again of innocent Black people being murdered, which in itself is traumatic. And has been shown to be connected to PTSD, just watching these images and watching these videos. And unfortunately, my son saw it. And the next day, my husband and I were going to go out for a walk, and he completely broke down, and he's crying and he's hyperventilating. And he's like, I don't want you to die. Wow. Simply by going on for a walk, he connected the fact that being Black and going for a walk increases your risk of death. Wow. And that for him was terrifying. And I'm just like, he's 6, and I have to sit down and explain this to him at 6 and have a conversation about racism and discrimination. That and I want him to maintain his innocence, but he can't.
So in that moment, we have this increased anxiety, this kind of activation of a survival response of like, exactly. Well, let me protect you because of what happened to that man on the TV.
Right. Exactly.
Wow. Oh my goodness. I wanted to shift a little bit and talk about how trauma can affect our interpersonal relationships. How sometimes the experiences that we have, the way that our system has been kind of shocked by adversity and stress, how that can affect even our day-to-day conversations with people. One of the things we had talked about was like the teacher with the student, and they're kind of just saying, I need to do this homework, but then maybe the way they raise their voice or the way they kind of hold their body, the student is responding to that and kind of starts to get agitated. Mm-hmm. And it seems like they didn't do anything. I didn't say anything to you. Why are you responding this way? And I wonder how that kind of plays out in other interpersonal relationships too, even for adults, or, if you could talk a little bit about that.
Sure. I mean, a part of building relationships is building trust. Mm-hmm. And often individuals who have experienced significant trauma struggle with that foundational aspect of building a relationship and trusting another person. And often it's a legitimate concern. Like, can I trust you? Even thinking about being an African-American in the workplace, or being an African-American when you're pulled over by police. We have plenty of evidence showing that either as individuals, we have had prior negative interactions, or watching on the news that individuals who look like us have not been safe in these situations. And so, just as you mentioned, your reaction may be to your past or the past that you've seen from other people, not necessarily to what's happening. And so there's always these questions. Well, why don't you just trust that the system will work for you? Or why don't you believe that justice will be served? Or why do you always think everything is about race? Like, if you don't get a promotion, why do you assume that you didn't get the promotion because you're Black? Well, there's a lot of evidence showing that may be a large part of the issue, both my personal experience and what I see happening every day. And so that certainly impacts our feelings of safety in the workplace. It may impact motivation. If you feel like no matter how hard you try, your work will never be acknowledged or recognized, that impacts your growth potential. And so, certainly, or, your comfort level at work. I often, talking to my patients, I often hear, particularly Black women, they're either told that they're too aggressive, or they're too shut off, or, you don't talk enough. And so, because again, if you're in that survival mode, you're just trying to get through the workday. You're not necessarily in a place where you feel comfortable opening up to your colleagues or feeling safe with colleagues. Can you trust them? Yeah. And particularly if you've been in a situation where you've experienced, or you've been in a work situation where you were minimized or diminished or discarded, of course you're going to have a hard time. And so there's always that, that angry Black woman trope, like and that's not the case, is that we have to protect ourselves, because very often many of these environments that we're in, they're not safe, and we don't feel safe.
Wow. And it sounds like in those moments, there's so much that's like projected onto.
Right.
It's like everybody has their expectation. I expect Black people to be ... And when you don't fit that mold, there's this kind of sense of, why aren't you this way? Right. So, and again, that's an unconscious bias. If I expect the Black woman to be supportive, helpful, kind of like the maid kind of role of like, I'm going to do this and that. Then if you don't do it, then why aren't you being more helpful? Why are you being so standoffish? Yeah. If I expect the Black person to be the entertainment because they're always either the entertainer, the sports star, and you're just a quiet person, well, why are you so cold? Well, you should be making us laugh, you know?
Exactly.
Of course, they don't say it that way, but it's kind of this implicit expectation of like projected onto the Black person. When you don't fit it, there's a sense that there's something wrong with you. That you're not meeting my expectation.
Yeah, and it's exhausting. I've had people tell me, you're not strong enough. You need to be more assertive and more aggressive. And then I've had those same people tell me, you sometimes you're too assertive. It's overwhelming. I can't win. Like I don't know how to be both simultaneously, you know. And many other people don't have to meet those unrealistic expectations. And I mean, it's exhausting. It is exhausting to be a Black person in predominantly white environments. It just is, because it is a battle that you have to fight every day.
Yeah. And imagine then, of course, you have to get up every morning, you know, get dressed, get in your car, drive through the horrible traffic, and then show up at a workplace where you're kind of like constantly having to be a bit vigilant, right?
Right.
Vigilant about, well, how am I coming across to other people? How are people perceiving me? All these other things. And then, of course, if you're in a position where someone is giving you a performance review at some point, then there's kind of a sense of, what is this review based on?
Right.
You know, and of course, that's, as you mentioned, it's exhausting, it's stressful. That day-to-day kind of wears at you. And then you wonder, why do I feel tired all the time? Why am I snapping at people that I love? You know, why is my appetite all over the place? Why are all these things going on? And it's like, your body is under constant stress. And as you mentioned, like this fight, flight, freeze response is meant to be a short-term thing. And then you go back to a resting state. But what if you're hypervigilant every day because you're working in a white space?
And you can never let your guard down.
Yeah.
And there's actually a term, it's called weathering. And it's specifically looking at that experience of living in an environment or living in or working in a place where you have to constantly code switch or be that individual or try to be 15 different people at the same time. And that weathering, they've shown that when you have to go through that, and it has an impact on your body, so it ages you. And so the psychologist that coined the term, her name is Geronimus. And so what she found in her study, looking at 40 or 50-year-old African Americans and 40 or 50-year-old white Americans, the African Americans were aging early. So they, on average, their body physiologically were 10 years older than their white peers. And she specifically stated it was because of this experience of weathering, this tearing down of our psyche, our mental and physical health.
Wow. That's a kind of sobering. It's quite sobering to kind of know that that's happening. And it'd be so interesting to have research comparing Black people in this country versus other countries and kind of to see what the differences are, because as we know, in other countries, discrimination and unconscious bias exists, but in different forms, in different ways, it plays out differently. So it'd be so interesting to kind of see how it might compare to other places. But it's, it kind of makes me think about, when you're having to be on guard all the time at work and then you don't get the promotion, as you mentioned, and someone says, well, how do you know you didn't get the promotion because you're Black? And it's like, well, maybe I don't know, but the fact that I have to think about it and worry about it is because it has happened. It's been known to happen. And so, of course, it enters into what I think, because it's possible. It's completely possible. Whether or not it's true in the situation, I don't know. But my brain now has to think about it because of how common it is, that it's a factor. For salary, for promotion, for all sorts of things.
For everything. And again, perceived discrimination is actually equally as damaging, if not more damaging, than that outright covert discrimination. Because again, just as you said, you have to think about it. Did that really just happen? And then we've all had that laying in bed ruminating, like, what happened today really just happened? Like, was I overreacting? And then you don't get that validation from other people. Well, how do you know it was really racism? So then you're almost like you're re-traumatized or further traumatized because you have to defend yourself against a potentially traumatic experience. And you have to justify your reaction, or you have to convince someone else that your pain is real.
Yeah. And that last thing you just said, where you have to convince someone your pain is real, that sense of validation, I feel like that's common to kind of all traumas, and it's another kind of validation for the existence of racial trauma too. Is that all these same things that you would experience in all other kinds of trauma, you experience with racial trauma as well. This kind of sense of having to explain to people that you really are in pain, and how do I show them that this is real for me. But I also appreciate that you said that perceived racism is just as damaging. I think it's something that a lot of clinicians may not realize, because I think a lot of times when a client comes to a therapist and talks about racism, the therapist is focused on, is that true? And if it's not true, you need to just kind of like chill out, rather than kind of recognizing that even if it's a perception, it can still be pretty damaging. And so it needs to be addressed regardless of whether or not it's true. If that's your experience, let's talk about it.
Exactly. I don't need my therapist to prove that I experience racism. That's not helpful.
Yeah.
It's not. And in fact, it shows me that you don't understand.
Right. And I think it's part of the education. I think that a lot of therapists, if they are not looking into it for themselves, that they should be kind of looking into understanding how to handle when people bring up issues of racism, people of all races, when they bring up issues of racism to the therapy session, that the issue is not about whether it happened. It's about how this is affecting the person emotionally and all that. So I guess what I want to kind of talk about is where do we go from here? This idea of, this system, it is kind of what it is. We're trying to fight the system, so to speak. What are some of the factors that you think will help to kind of help our community kind of make a change? Some of the things that maybe you think about or talk about.
Sure. So, and again, it depends on who I'm talking to. So if I'm talking to clinicians, you need to screen for race-based trauma. You need to be asking these questions as a Black person in America. Do you feel like your experiences have hurt you? And, there are even formal ways that we can ask that. There's a screening questionnaire called the Everyday Discrimination Scale. There's a Trauma Symptoms of Discrimination Scale. UConn has a scale. It's called the Racial Ethnic Stress and Trauma Survey. And so there are many options available if you actually want to ask those questions and you want to know the answers. I know often people don't ask because they don't know what to do once they have that answer. So if someone says, yes, I've experienced racial trauma, then the therapist is like a deer in headlights. Right, exactly. So if that person told you that they had experienced sexual abuse as a child, would you not address that? Right. Would you not do something if they told you that they, were in a horrible car accident and they're having nightmares and flashbacks? Would you not address that? So there is no difference than with racial trauma. In the same way that the expectation is you would address any other traumatic experience, I expect you to screen and ask and address racial trauma in the same way and not be afraid of it. Even if you are white and your patient is a person of color, even if you are a person of color, you still can't assume that your experience is the same. We still have to address it and validate their pain. Of course, walking into an environment where no one looks like you and you feel isolated and ostracized would be a painful experience. Of course it would be. Of course that may impact your sleep and your eating and your energy levels. Now, how do we deal with that, right? So obviously in an ideal world, we change the big things. We change what's led to the trauma. We change the institutional and structural racism. Until we can change that, and hopefully we can do these things simultaneously, we address the trauma. In the same way, when someone is in the midst of a unsafe or unhealthy relationship, we have to try to get them out of that relationship. And so depending on the work environment or depending on the setting, if I'm able to support that person in getting out of that unhealthy setting, absolutely, then that's what we do. But a part of the setting is living in America. So that setting is not as easy to get out of. And so we have to try to work within those limitations. And so other things that, we can do both as individuals who have experienced racism and as therapists, one thing that I tell everyone, we have to focus on what we can control. And I'm sure many people have talked about that through COVID because so much is out of our control. And if we try to change our boss, that is an exercise in futility because that may not happen. Yes, maybe you can go to HR and maybe you can go above them and try to address change, but specifically trying to change that person impacting their behaviors may not happen. We can't control that, but we can control how much time maybe that we have to spend with them face to face. Maybe we can have this meeting via email rather than in person. Or maybe what I can control is what time I get out of bed in the morning to mentally prepare myself to walk into the office. Maybe what I can control is that I'm going to get up 45 minutes early so that I can walk before I get into work, because I know that walking reduces my stress. And so, one thing we have to do is get ourselves out of that fight, flight, or freeze as much as possible, not just for the immediate, but for the long term. Again, it is not healthy for us to be in a persistent state of stress or survival mode all the time. It is literally wearing down our bodies. So we as individuals have to be intentional about reducing our stress response. And so we can do that through prayer, exercise, meditation and mindfulness, talking to other people, therapy, processing what's happening, focusing on the things that we can control, reducing our stress response. And all of that is individual. What works for you may not be the exact same thing that works for me. I have a Peloton. Peloton reduces my stress. That is something I try to do when I know I'm about to have a stressful day, when I know I have a long day full of meetings or it's going to be really challenging. I have to be intentional about incorporating that into my day just so that I can make it through. Or having something to look forward to, planning something, knowing that, okay, if I can just get through these 2 weeks, then I'll have a break and, on that Saturday. And so again, being intentional about putting things into your life that reduce your stress response. And then also being intentional about not letting things into your life that increase your stress. As I mentioned, I don't watch the news. I can't watch the news. It hurts me to watch the news. It hurts me to see how Black people are portrayed. It hurts me to see Black death being put on TV as entertainment and not validating or acknowledging the beautiful life that this person lived. It is too painful for me. And I find that increases my stress. So I don't let that in. I don't read the news, or I limit my social media, or I turn off the automatic video plays because I don't want to see it. And I know what that does to me. So I am very intentional about who and what I let into my mental and physical and even spiritual space, because I need to make sure that I am working on reducing my stress response, not increasing it.
Wow, those are fantastic tips. You mentioned the Peloton. I just discovered Peloton really this year. Well, actually, I've been told about it since last year, but I kind of felt a bit, I don't think I can handle it. But I did finally break down and get a Peloton, and it's been fun. It's been fun. Yeah. So I'd say that's a good one. But people, figure out what works for them, and I like those tips. Trying to figure out what to let into your life. Kind of slowing down. How do you take the news in? Are you going to have it kind of in the form of like the news on the TV where it's very sensationalized? You're going to try to consume it on the internet where the headlines are kind of clickbaity. Like, right. How are you going to get the information you need without it being overwhelming? Right. And I like that tip about screening for race-based trauma, because I think as clinicians, often we're taught to kind of screen for trauma in general, and we don't really have a habit of asking about racial experiences as people go through the world.
Right. And again, and most people who have gone through it, who have experienced it, don't identify it as trauma. So we have to be clear about the language that we use. Words matter. And so if you just ask about trauma, most Black people are not going to assume that police profiling was traumatic for them. Or, feeling like they were targeted in the school setting because they were the only Black kid in the class. They may not identify that as trauma. So we have to be explicit in asking, have there been experiences where you felt like you were treated differently because of your race? And do those experiences sit with you? Do you think about those? Before you go to bed at night, are those situations running through your mind? Do you wake up thinking about that? Thinking about going to work and walking into a potentially toxic environment? Does that affect your appetite? Or, do you avoid certain places because of that? And so we have to be very clear about the language.
And what was the name of that scale? It was called the Everyday.
Yes, the Everyday Discrimination Scale. And that one is that one's actually free, and you can. It was created by a Harvard social scientist, and I can't remember his name. But if you search for Everyday Discrimination Scale, you can find that one.
Okay. Wow. Well, Thank you so much for coming on the show today. I think this was a really great discussion. I feel like there was just so much that was packed into like 45 minutes. And I think I'm going to have to kind of go back and listen to everything all over again. And so, for those of you guys that are listening, I said, like, if you really enjoyed the content today and this was very helpful, a great discussion, just drop a comment and just say that. Just say this was a good discussion. And I'll also be uploading it later on in the week to Apple Podcasts, so you'll be able to kind of listen to that on the go. So thanks again, Dr. Christian-Brathwaite,
Thank you for having me. And thank you for doing this show. This is amazing. You're amazing. Thank you.
Thank you. And thanks for you guys for listening in. Have a great week. So let me just see if I can do my end here.